testing immediately. Every day that you wait and see or hope that it might just be a cold and you delay getting tested is a risk to you, your family and the broader community. It's one of the factors why some people have infectious days in the community, that they're not coming forward to get tested immediately upon developing symptoms. Symptoms include headaches, sore throat, running nose, fever, loss of smell or taste. If you have any of these, please come forward for testing. Also important to come forward for testing if you have been at any of the identified exposure sites during the times that are identified on the website. So please continue to look at those exposure sites. They're updated several times a day with the latest information. So if you have been to one of those exposure sites at the times that are indicated on the website, then please do also come forward for testing. Compliance continues to be very strong across the ACT. The great work of ACT Policing, Access Canberra and WorkSafe ACT continues. Yesterday there were 284 traffic stops and only 4 directions to leave the ACT. Business compliance continues to be good and improving as a result of some of the enforcement and educative exercises being undertaken by Access Canberra in particular. The issue that we've talked about for several days now, though, still remains the most common reason why businesses are not compliant, and that is staff not wearing face masks properly. So again, just a reminder that wearing a mask properly means it's got to cover your nose and your mouth, and a mask sitting under your chin is not particularly useful. On vaccination, the ACT has passed the 70% first dose milestone for our population aged 16 years and above. We were also getting close to 50% of our population aged 16 and above being fully vaccinated. On current trends, we will cross that threshold in about a week. We do, however, have more than 80% of Canberrans aged over 75 years now fully vaccinated. From tomorrow, we will start vaccinating Year 12 students to enable them to sit the ACT scaling test in person. So if you are a Year 12 student and you haven't yet booked a vaccination appointment, either through an ACT government clinic or your GP, please do so. We've got this 2-week window where we've allocated Pfizer doses for Year 12 students across all schools, public, private, Catholic, independent. All Year 12 students have this priority over the next 2 weeks. So in summary, for those who've joined late, 15 new cases overnight, 13 of them linked, 6 in quarantine during their entire infectious period, 7 in the community for part of their infectious period, and one of the key things driving that is the delay some people have in coming forward to get tested. So as soon as you have symptoms, please come forward to get tested and keep checking the exposure sites on the ACT COVID website. If you've been to one of them in the time, please come forward to get tested. 9 people hospitalised, a reduction on yesterday, and 1 remaining in intensive care, and again we send our love and support to the family of that individual. I'll now invite Dr. Coleman to provide an update on the new cases and epidemiology. Following Dr. Coleman's update, myself, Dr. Coleman, and the Minister for Health, Rachel Stephen-Smith, will be available to take questions. Thank you very much and happy Father's Day again.
And good morning, everyone, again. Thank you very much, Chief Minister. As Chief has already gone through, since our update yesterday, we've recorded 15 new COVID-19 cases, bringing our total cases for this outbreak to 374, but with 17 additional cases recovered in the last 24 hours, bringing our total number of recovered cases to 137, we now have 237 active cases. Of the new cases today, of the 15 new cases today, 13 can be linked to known cases or ongoing clusters, and of these 13, 11 are household contacts. So household contacts continues to be our majority of new cases. Out of the total of 15, 6 were in quarantine during their whole infectious period. Out of the remaining 9, 2 are still under early investigation and 7 spent time in the community for at least part of their infectious period. And just to reiterate what the Chief has mentioned, 9 people are in our hospitals. Only 1 of those are in ICU and requiring ventilation, and 7 of the 9 are unvaccinated, with 2 people having received 1 dose of vaccine. We now have just over 1,400 self-identified close contacts and over 330 active exposure locations. So we continue to have close contacts in quarantine and to identify new exposure locations. So as I say every day, please, please, please continue to check our website, keep up to date with the new exposure locations and do what the public health advice recommends. The age group proportions for our cases remain unchanged today from yesterday. 85% of our cases are under 45 years of age. This is exactly what we are seeing in other outbreaks around Australia. But we now have 16 public sites of transmission, with the addition of the Busy Bees Childcare Centre in Brindabella with 2 cases now, and the Priceline Pharmacy in Woden with 3 cases. Furthermore, one of our new cases in the last 24 hours has now been linked to the KFC in Dixon. I did undertake yesterday to just give you a further update on our overall unconfirmed cases with no known sources, or our confirmed cases with no known sources from yesterday. In terms of our total 374 cases that we have that are part of this outbreak, we are confident that 325 are linked in some way to known clusters. This means that 47 are now unlinked, and we're unable to confirm how these cases acquired their infection. However, noting that of these 47, 20 of these have been in the last 2 to 3 days. So there's still significant hope that further investigations will be able to find a source for hopefully the majority of these 20 cases. And we know that 2 of these are extremely early in our investigation, as they came in very late last night. But as you can see, and as we've talked about before, this is an ongoing process, and these numbers continue to change every day, and I'll continue to provide an update for you every couple of days, as it makes sense too. Now, I know Chief has talked about testing, but testing and symptoms is one of the most important things that we need everyone to take on board at this point in time. What the team briefed me on this morning as part of our update with our outbreak analysis is that we are seeing some people, and it's about 1 in 3 of our cases, have waited for 2 days before getting tested after their symptoms has appeared. So when we look at all the cases that we currently have, there's up to 2 days difference between when they first had symptoms and when they got their test for 1 in 3 people. It is so important to go and get tested immediately as soon as you get any of these symptoms at all. We don't have any lines or any problems with getting tested at the moment, so please. For that reason, I'm just going to go through what the main symptoms are and then the minor or the less common symptoms for everybody so that you can hear it now. And in case you're worried that the symptoms that you're having aren't part of COVID, here they are. More commonly, fever, cough, a sore throat, shortness of breath, loss of smell or taste, and a runny or blocked nose. And then less commonly, we see muscle and joint pain, diarrhoea, nausea, headache, vomiting, loss of appetite, or fatigue. So please take note. These symptoms are up on our website. If you're unsure, have a look. Each person may experience a different set of symptoms. You may have different symptoms to the person you are living with or the person that you are speaking with as part of your family. And remember, some positive cases don't experience symptoms at all. That's why it's really important, if you've been to an exposure location, if that advice tells you to have a test and you don't have symptoms, go and get a test anyway. So my shout out today, in conclusion, is to all our fathers, carers and guardians. Thank you, in particular to our essential workers that are missing out on time with their family to continue to give all they've got to our COVID response. And also thank you to those that are juggling work from home and homeschooling. I know this is tough. Thanks to you all for continuing to do the right thing and staying at home to help us limit transmission in the community. I do know that this means that a lot of you can't be with your loved ones today for Father's Day, even though they may be just around the corner or, as is the case for me, in a different state or territory. But I do wish you all a happy Father's Day. I hope you have a great day within your household context, and I'll pass back to the Chief for questions. Thank you.
Thank you very much, Dr. Coleman. Happy to take questions. Who's stepping up first? Dominic, Riot Act.
How are we going?
Thank you.
A few days ago, you mentioned you'd provide an update on outdoor recreational activity as we start to see cases develop. Is there any update about any potential easing of restrictions within that sector?
Not today, no, but we will obviously return to address those issues in the coming days.
Today's case numbers are obviously a lot less than yesterday, with a lot less in the community. How are we looking over the next few days to be able to potentially ease some minor restrictions further like we did last week?
There's no intent to do that at this point in time. We obviously have checkpoints, but the settings that are in place now are likely to remain. Certainly people should work on that basis. We'll signal in advance of when we will next update, so people have a bit of notice and know to expect that there may be some changes, but for the foreseeable short term, I'd advise people that the current settings are going to stay.
Chief, Premier Berejiklian says New South Wales will certainly not have a statewide lockdown ever again once 80% vaccination rates are reached. Will the ACT ever be able to have more localised lockdowns once we get to a high vaccination rate, or are we just too small?
I tend to say we're probably too small, that although at times in our city there can be quite a sense of north of the lake, south of the lake distinction that tends to dominate local politics. So there is quite a bit of movement across the lake. It's not the barrier that many people see it as. So I think our jurisdiction is too small, but I appreciate that in the New South Wales context, it is very, very different. It's a big state, and so I can understand why the Premier would make that observation for a very large jurisdiction. I think probably wouldn't make sense to have a small pocket of Canberra locked down and other things moving freely. But of course, these things are subject to the nature of any particular outbreak and advice from the Chief Health Officer at the time. But I think the factors that your question alludes to are reasonably clear in terms of how we would have to respond in Canberra.
Hi. I'm not sure if you saw that Stuart Robert made some remarks earlier today that the Delany roadmap wasn't set in stone.
Yep.
Did you have any comments on that, and is that something that you were happy to hear?
Okay, well, yes. So Minister Robert appears to have read the national plan, and at the bottom, in a font larger than most other font, it says, "The plan is based on the current situation and is subject to change if required." So I presume that's what the Minister was referring to. It is sort of expressly there in the plan. I have referenced it before, so that would appear to be consistent with what the plan actually says. So I will be fascinated to see how this is reported across the nation today, but even just a cursory glance at the one-page document that constitutes the national plan does say that it is based on the current situation and subject to change.
Has there been any further updates on discussions with the Federal Treasurer about potential financial or income supplements once we exit the lockdown and places are no longer hotspots, so people are able to get tested, are able to isolate and the like?
Sure. Yeah, so we do continue to engage with the Commonwealth. We're not the only jurisdiction needing to have that conversation. So there hasn't been an advance between Friday and Sunday. Whilst many of us are working 7 days a week, it doesn't necessarily mean that I can provide an update on every element every single day. So as soon as we can, we will.
Given almost half of the new infections today were in the community while infectious, does this mean that the message to stay home is not cutting through, perhaps?
Well, I think we've obviously Dr. Coleman has addressed one of the probably the single largest factor there. Others relate to, and you see this in the exposure sites, that there are occasionally essential workers who are becoming infected unknowingly, then infectious in the community for several days before symptoms develop. They get tested and then obviously they're quarantining. So I wouldn't draw that conclusion. I think by and large the compliance has been very good, and that's one of the key protections that the lockdown buys us. If we weren't locked down, then the risk would be significantly greater for each of these infectious in the community cases. The other factor that continues to improve for the ACT day by day is the number of people who've had either a first dose or who are fully vaccinated. So as each day and each week goes by, we get to vaccinate more people. And so as we get closer to those very high levels of vaccination that I think the ACT will achieve, and that will be to go even beyond 80% fully vaccinated, each day we march closer to that goal means that the other two measures that we're using to keep cases as low as possible, and that being test, trace, isolate and quarantine, and the public health measures, we can rely less on them the higher the vaccination rate gets. But we're still at a point now where the vaccination rate is just too low and we have to use those other two measures. But as we have acknowledged throughout the process, and as has been experienced on a much greater scale in New South Wales and Victoria, the test, trace, isolate and quarantine system is not 100% perfect, where there will always be some cases that you just don't get the test in time, they don't isolate in time, they don't quarantine in time. And so that's why you still need the public health measures as well. But as the vaccination rate increases, your system and your total public health response can rely a bit less on TTIQ and the public health measures, but we're still a way away from that because our vaccination rates are not yet high enough.
Chief Health Officer, if that's all right.
Okay, thank you very much everyone, and happy Father's Day to everyone watching. Thank you.
Dr. Coleman, with the people in the community, part of the factor relying on restrictions and the success of the program is the risk they posed whilst in the community. Are you able to provide some of an update about the cases today and yesterday, about how much of a risk they posed?
There's variable risk in each of the cases. We do some classification about the amount of risk, and that is based on often people are wearing a mask as they need to because they are doing stay at home and abiding by the public health directions, and we count that as lower risk. However, higher risk are if that's not occurring and the amount of time that they may have been spending in the community. So we have a really big range of low risk through to high risk in the community. I can't give you exact numbers, but it's certainly a range.
Given that range, are you able to say roughly, are we seeing more high risk, more low risk? Is mask compliance reducing that risk? What's the deal?
Yeah, so it's not just masks as well. It's about the places that you go and who you mix with and all of those. I know there's a lot of focus on masks, but there are other things that we can do to reduce our risk if we're infectious in the community. Look, not really. I think what we are seeing is infectious people in the community, many times unknowingly for some of the reasons that the Chief Minister has just talked to, and sometimes knowingly. And we just continue to work with those individuals, and we just try and reduce the circumstances under which we are seeing infectivity in the community. But we're on that plateau at the moment, and we just need to closely monitor that over the next couple of days to measure the impact of the last couple of days.
What requirements are in place for the cleaning of venues once they're identified as an exposure locations? And does it depend on whether it's close or casual, and what's kind of the process there?
Yeah, look, absolutely. We have a whole team that works with locations which are identified as being a potential public health transmission site, and there are a range of different options, and we provide them with specific advice about what is needed. Sometimes it's a fairly normal light touch clean that we would see as being part of our regular cleaning process, and sometimes it might be what we refer to as a deeper clean, and that's when we are concerned that someone who's been infectious in that building or that location for a significant period of time, and we just want to make sure that all the surfaces are clean. So there's a range, and we work with those venues to provide that advice.
What is the sequencing data of those 47 unlinked cases told us about how many entry points that the virus might have had into the ACT?
It's actually quite interesting. So what we're seeing is that about 95% of the cases are actually all genomically linked. So that's telling us that that's linked to the principal clusters of cases that we saw. But we are identifying some sequencing in about 4 or 5 specific cases which don't seem to be linked to that genomic pattern. So there is a suggestion that there is a small number of cases continuing to come into the ACT from New South Wales, which aren't part of our current cluster. And I guess that's what we need to expect moving forward. We know that there's still essential travel required. We know that to live our lives and have the essential services, there needs to be people moving out. But some of these cases are being identified through our exemption and testing process, so that's our system at work.
Do we need to ramp up some of these exemption processes or testing processes for essential workers coming in if we have 4 to 5 that are not linked from New South Wales?
I'd suggest to you that given that 95% of our cases are linked to the initial cluster, that it's actually working reasonably well. I think that we've identified the cases through our process. Nothing can ever be 100% perfect. We actually have probably one of the strongest exemption and testing processes around Australia because we're able to provide that individual service to people. So I'm confident at the moment. I can never promise you, I never make promises that I can't keep, and we will not catch everything that comes in. But we'd have a two-pronged process. One is working with individuals around their exemptions and what they need to do when they come in. The second one is this desperate plea to everybody to make sure that they monitor their symptoms if they've been to an exposure site and get tested.
We might not be able to get everything perfect, but we would learn from mistakes. Have we implemented any new measures to potentially stop this happening again?
Absolutely. We're constantly doing a quality assurance process on all of our measures. We're constantly reviewing our at-risk LGAs, local government areas in Greater Sydney and Victoria, and applying different perspectives to our exemptions. So we might focus on some over others. There are still some LGAs in Greater Sydney that we actually don't accept anybody coming in for. So I think that we do constantly adjust our risk and our management of the entry of people coming in.
You spoke at length yesterday about the importance of people staying home when they're in quarantine, and that includes the whole household and all that kind of stuff. Is that something that's been an issue throughout the outbreak, or have there been instances of people leaving quarantine?
So I'll just clarify again, staying at home under our current public health direction because we're in lockdown, and then there's the quarantine requirements, which means just do not leave your house at all. Look, I think I'm finding it very difficult to actually stay at home under the current lockdown, even though I get to come to work. I've been in quarantine once in my life and it's incredibly difficult. And I think for some people and some families, it can be harder. If you have a large family with 6 to 10 people and you're all living in a house, it actually becomes much harder to stay there. So I think part of our job is to work with people whose circumstances make it harder for them to solely stay inside the house for a full 14 days. So I think we'll always have a range where we get people who are able to do it very easily and comfortable, and then there are people who actually really struggle with it for all sorts of really important and valid reasons. And that's what we do in public health a lot of time, is to work with those people to do everything we can to help them reduce their risk of exposing other people in the community.
Do you have any examples of what that might mean? I mean, are people being allowed outside the house when they're meant to be in quarantine?
So in terms of the support we provide, we make sure that the people that are coming in or are on the phone are actually known to the people, that they're actually respected, and we can have a proper conversation about that. We can organise food deliveries. We can organise financial supports for people who are concerned that they still need to do their job to get money. There are actual payments that we have that mean that people do not need to go to work to get money if they need to be in quarantine. So they're the kinds of things that we want to work closely with about to make sure that people, there is no pressure or no reason that they don't know the answer to stop them not staying at home.
We've seen a large spike in new locations over the last day. I think almost 100 were listed yesterday. Is this concern over the next few days that we could see a potential spike coming up from these locations?
And I think that relates to particularly our large number of cases yesterday, with a large number that were infectious in community. And that's exactly how we will see the trend moving. As there's more exposure sites, there's likely to be more cases that come out of that. We will see that dribble on for a 14-day period, because that's about the time frame for the incubation period. But the vast majority of those will play out in the first 7 days. So I guess my word of caution is lower today, high yesterday. Because we're a small jurisdiction and we're seeing smaller number of cases than other jurisdictions in the outbreak, we might see more variation in our total numbers. But let's monitor several days' worth of trends to see where this is going.
How concerning are those 47 unlinked cases, and how important are the number of unlinked cases when factoring in the government's response during the outbreak?
It's one of the most important things that we consider, but I think we also consider not all of those means that they're linked to ongoing chains of transmission. So what we can see is sometimes they burn out and we don't see ongoing transmission for all sorts of reasons. So the most important thing is to monitor all of those to just see ongoing chains of transmission or whether they've burnt out. And we just keep doing this every couple of days, seeing where we're at, what the risk in the community is, how we need to balance our public health social measures against our ability to contact, trace and isolate.
Do you have any more information about that exposure site in Goulburn that's popped up?
No.
Sorry. If
That's
we're
okay.
expecting more cases in the next 2 weeks, have we put in more support services, more contact traces, more support for hospitals to prepare for that?
Absolutely, that's part of our planning, and we've been doing that for the whole 18 months, but in particular in the last 3 weeks since this whole exercise kicked off, we've been looking very closely at what we need so that we can surge up and down as we need to. It's entirely possible that we will see more cases come out over the next 7 to 14 days, and we will be looking at those closely. Unfortunately, we just don't know. At this point in time, the lockdown means that there won't be massive, that hopefully we won't see a growth in those. We will just need to wait and monitor and see what we're going to find.
Just lastly, we've had a few questions about this outdoor recreational activity. Are you able to provide the epidemiological advice behind it as to why we can't have, tennis and golf that also have the social aspect, especially for many older Canberrans, compared to being able to spend 2 hours in the park in a picnic? being able to go for a walk with the same people. What's the reasoning behind that?
Dominic, I understand that this causes a lot of frustrations for people. And I think, as I spoke to yesterday, there are 100,000 different unique circumstances that everyone has a particular activity that they would like to do. As the Chief and I have talked about, this is about a cumulative risk. What we try and do is we have a look at what's a set of activities that are low risk, that we can communicate clearly on, and that we can hope that everyone can abide by, to give everyone an opportunity. It is next to impossible for us to actually interrogate every single option and opportunity to provide that advice around why tennis, why not golf, why this and why not. The principle is smaller groups in the outdoor setting, non-organised, because of the organised potential is for larger groups to come together. Thank you.
Minister? Yep. First up, with just under 2 weeks left for the vaccine mandate for aged care, do you have an update about how many have been vaccinated, and then potentially the same for the disability sector?
Yeah, unfortunately, I don't have an update from the previous numbers that we had. So the last number I had in terms of residential aged care staff is from the 1st of September, and that was 87.5% first dose vaccination and 54.3% second dose vaccination. And again, I don't have an update on the disability numbers since the 27th of August. So all of these numbers come to us from the Commonwealth and we get them when we get them. But that was for NDIS screen staff, 58% first dose and 39.1% second dose. I am confident that we are seeing really strong take-up among aged care staff, and we saw the number of staff with first dose vaccinations almost double over the space of 3 weeks. So I'm confident that when we get the next lot of numbers, they will be higher, and we'll continue to work with the Commonwealth and with providers and staff to ensure that that's the case.
Just on public housing, we've seen areas of concern pop up across a few. Residents of Condamine Court, I believe, are coming out of their isolation period soon. What's the government doing, or what extra restrictions have been put in place to make sure that this doesn't happen again, to protect more vulnerable public housing communities?
Yeah, so I really want to start with an enormous thank you to those residents of Condamine Court who've been in quarantine for the last 2 weeks. Today is their last day of quarantine. We did exit testing at Condamine Court on Friday, and all of those tests that were taken came back negative. So that was really a fantastic outcome. I know that quarantining, as Dr. Coleman has talked about, quarantine is hard. Quarantine is particularly hard in some of the circumstances she talked about. It's also particularly hard in an apartment building setting where you've got no backyard, in some cases no balcony. So for those people who've been in quarantine at Condamine Court, thank you so much. The vast, vast majority of residents have been incredibly cooperative. They have understood the reason for their quarantine, and they've worked with our staff to ensure that that could be undertaken safely. So thank you to all of them, and to everyone else who's quarantining in an apartment. We know it's hard. Thank you for doing the right thing. After the Condamine Court residents are released from quarantine at midnight tonight, our multi-agency team will continue to have a presence for both testing and support services through a phased withdrawal process over the next few days. We'll also continue to maintain a surveillance testing program over the next week to allow ACT Health to monitor any potential for spread of COVID-19 that hasn't been captured through the quarantine period. So a transition plan has been put in place to ensure that clinical care and wraparound supports, including the continuation of the 24/7 telephone line, direct phone line for residents, is maintained for some days. So I want to take this opportunity to thank staff across the ACT Health Directorate, Canberra Health Services, Housing ACT, Community Services Directorate, Emergency Services Agency and ACT Policing, among others, who have worked together to support this multi-agency response. And I particularly want to thank our community non-government sector partners who are continuing to support tenants and the public health response both in Condamine, at Ainslie Village and across our social housing sites. These include Karma, Directions, ACT Shelter, Healthcare Consumers Association, Community Services One and Community Options. Thank you so much. We know there have been some rocky periods, particularly early on in the response to Condamine Court. We have learnt a lot of lessons that we have put in place in responding to Ainslie Village, and will continue to learn lessons and build those into our current planning. The Health Emergency Control Centre will also facilitate an after-action review that will look at the whole response in terms of Condamine Court and learn any lessons from that that can contribute to our future planning as well. So again, my thanks to all of those residents and to everyone who has worked with us. It is a good outcome that those people are coming out of quarantine at midnight tonight, and we will continue to support them over the next few days in a phased transition.
Year 12 students are now getting those priority vaccinations starting tomorrow. For the students who, before that news came, went out and got AstraZeneca if they were eligible, who may now not be fully vaccinated before the exams, what will happen for those students?
So we have said, I think over the last few days, we've indicated that some consideration is being given to bringing forward that recommendation around second dose of AstraZeneca, so shortening the timeframe between doses. And I understand that Dr. Coleman is likely to have more to say about that tomorrow. Certainly, that has been what's occurred in other jurisdictions in an outbreak setting. So we're just working through the finalisation of that advice for both those students and anyone else who has had the first dose of AstraZeneca and is not yet fully vaccinated.
On that in-reach to public housing, Directions got double the amount of Pfizer doses you mentioned previously. Do you have any more updates about how much vaccine those in-reach programs are getting, and what the numbers have looked like over the past few weeks once we've seen the outbreak from originally Condamine Court, then into Ainslie?
Yeah, so when we talked about that a little while ago, Directions was getting about 600 doses a fortnight, but I don't have an update on that, and we've certainly been working very closely with them and with Interchange Health Co-op all through the early morning centre, because Interchange has also been providing vaccination through the early morning centre, to ensure that they can continue to get the number of doses that they need to meet the demand or their capacity to deliver vaccination appointments. So we had Directions on site at Ainslie Village yesterday providing vaccinations there, which was absolutely, a really positive thing to support the Ainslie Village community. We will continue to work with Directions to ensure that they have all the supply that they need, that they can actually deliver out into the community for both our public housing and social housing tenants, and also those who are experiencing homelessness. So there is a limit, obviously, to how many places they can be at one time and how many doses they can actually deliver. But we will work with them to ensure that to the greatest extent possible we are prioritising getting vaccination to those vulnerable community members, and which is protecting them, but also working to protect the wider community as well. Thank you. Oh, can I just say Happy Father's Day to everyone as well, just add my voice to that. To my dad, if you're watching, I know you've been starting to watch these press conferences. Thank you for everything, and Happy Father's Day to everyone. Thank you.